Welcome to The Explainer. Today, we are looking into a genuinely fascinating intersection of two massive global forces. On one side, you have the evolving reality of our global environment, and on the other, the highly complex, highly structured world of managed healthcare. Now, most of us probably don't think about environmental changes when we look at our monthly health insurance premiums, right? But as we're about to see through the lens of industry sustainability standards, these two things are deeply, fundamentally linked. I am so thrilled to guide you through this because we're going to uncover the surprising chain reaction that connects extreme weather events directly to the financial sustainability of your health insurance. It almost sounds like a trick question. How exactly does the weather forecast affect the future of health insurance? When we think about our healthcare, we're usually thinking about copays, deductibles, finding an in-network doctor, that whole shebang. We definitely don't typically think about shifting weather patterns, natural disasters, or food and water scarcity. But here's the thing. For the entities that manage our healthcare plans, this is no longer just some hypothetical ecological question. It is a critical, absolutely crucial business variable. And that is the overarching mystery we're going to solve today. We are going to track exactly how a change in the environment ultimately lands right on a corporate balance sheet.
Section 1. The business of managed care. Let's establish our baseline.
Okay, let's dive into this by exploring the status quo. We are drawing directly from the Sustainability Accounting Standards Board, or SASB, and their industry description for managed care. So what do these entities actually do? Well, they offer health insurance products across all the major markets: individual, commercial, Medicare, and Medicaid. They also manage pharmacy benefits and provide administrative services and network access for self-funded plans. Now, here is the absolutely crucial piece of the puzzle. In this industry, revenue is largely driven by medical cost inflation, while enrollment is traditionally tied to employment rates. The entire business model is built on predicting risk, predicting costs, and managing the overall outcomes of massive patient populations. Basically, they are risk managers on an epic scale. Moving on to Section 2, climate change and health, focusing on environmental shifts. So we have an industry whose core function is assessing and pricing human health risks, usually based on historical data. But now we're looking at a macro-level environmental shift that's literally throwing a wrench into those historical models. I want you to picture a ripple effect. It's like dropping a heavy stone into a quiet pond. That initial splash at step 1, that's the environmental change. Think extreme weather events or food and water scarcity. That splash creates a ripple, moving us to step 2, shifting disease incidence. Because the environment changes, the actual patterns of human illness change. Then, that ripple expands out to step 3, increased healthcare encounters. More people getting sick or getting sick in totally new ways means they need more medical care. And finally, that ripple hits the shore at step 4, material financial implications for the managed care industry. Let's actually walk through how this exact chain reaction plays out in the real world. Section 3, changing disease landscapes and their physical health impacts. Zooming in on that second ripple for a second, how exactly do environmental shifts translate into specific physical health impacts for us, for human beings? Now, what's really interesting here is how vividly concrete these examples are. According to the SASB standard on climate change impacts on human health, we aren't just talking about abstract warming. We are talking about highly specific, measurable health outcomes. We're seeing increases in allergic responses and asthma rates. We see a direct rise in heat-induced illnesses. We also see spikes in waterborne diseases, like cholera, which are directly linked to the increased incidence of natural disasters. And on top of all that, there's the risk of increased rates of human developmental diseases, things like malnutrition, driven by decreased food availability and scarcity. These are direct alterations to human health risks. Actually, let's pause and focus on one specific, highly surprising geographic shift outlined in the source material: the migration of tropical diseases, such as malaria, dengue fever, and other vector-borne illnesses, into non-tropical regions. This right here makes the abstract concept of climate change viscerally real. Think about it. An insurance risk model built, say, 10 years ago for a non-tropical region likely assumed the risk of localized dengue fever was 0, right? But as the environment changes, the geographic footprint of these diseases just expands. Suddenly, a managed care entity has to account for tropical diseases in populations that have literally never historically faced them. Section 4, rising healthcare encounters. Let's connect this back to the system. So we've seen the environmental change, and we've seen the resulting shift in diseases. Now we need to look at how these physical health impacts directly hit the healthcare system itself. Honestly, it really comes down to simple math. When you have shifting geographical incidences of diseases, like we just saw with malaria, along with broader changes in overall morbidity and mortality, it inevitably leads to a higher volume of encounters with the healthcare system. More people experiencing asthma attacks, heat-induced illnesses, or waterborne diseases equals more doctor visits, more emergency room admissions, more ongoing treatments, and obviously, more hospital stays. The system is suddenly being asked to process a much higher volume of care than historical baselines ever would have predicted.
Section 5. Material financial implications. This is the final ripple.
That massive surge in volume takes us straight to our final ripple. We are now translating human healthcare encounters into hard financial realities for the managed care industry. Because managed care revenue is tied to medical cost inflation and their core function involves paying out medical claims, a sudden, unpredictable increase in healthcare encounters creates a massive volume issue. According to the SASB standard, these changes present material implications for the industry. Specifically, entities have to look at projected impacts on revenue and rising medical costs. Think about it. If an insurance plan didn't price in the risk of a cholera outbreak following a severe storm or a sudden spike in asthma treatments due to environmental factors, the cost of paying those claims eats directly into their margins. Ultimately, this threatens overall plan affordability. If costs go up across the board, the price of the insurance plan has to go up, which puts a massive amount of pressure on the entire healthcare ecosystem.
Section 6. Accounting for climate risk, or how we standardize the threat.
The chain reaction is pretty clear, and the financial threat is definitely real. But how do investors and businesses measure and prepare for a threat that is constantly evolving? Well, this is where the Sustainability Accounting Standards Board steps in. SASB Standard HCMC 450A.1 specifically requires managed care entities to discuss their strategic business approach to addressing the significant risks related to the effects of climate change. Transparently discussing this strategy is no longer just a theoretical exercise, it is an absolute industry necessity. The standard points out that entities that actively manage the risks posed by extreme weather events and potential changes in illnesses are just much better positioned to protect shareholder value. Investors need to know that a managed care company isn't just flying blind into a changing global environment.
And this brilliantly illustrates the necessary evolution in how these companies have to operate today. Managed care entities have to adapt to survive. On one hand, we have historical risk models. These rely on past, static geographical data. But as we've just learned, the past is simply no longer a perfect predictor of the future. So on the other hand, we have what SASB requires entities to discuss: climate-adjusted risk models. Companies must explain how specific risks, presented by changes in geographical incidence, morbidity, and mortality of diseases, are actively being incorporated into their risk assessment and risk adjustment activities. They have to build models that can account for a moving target.
Which leaves us with this final, vital question. If climate change reshapes global health, is our healthcare system financially prepared to weather the storm? We've traced the ripple effect today all the way from extreme weather and resource scarcity to shifting diseases, to sudden spikes in hospital visits, right down to the financial bottom line of managed care entities. The integration of climate-adjusted risk models isn't just about corporate compliance. It is about ensuring the very sustainability of the healthcare plans we all rely on. It's a fascinating look at how deeply interconnected our environment and our economy truly are. Thank you so much for joining me for this explainer, and remember to keep questioning how the changing world around us is reshaping the systems we depend on every single day.